So today's topic is special diets. Today's topic is special diets. Is my voice audible to all? Page number is mentioned in your chat box. My page number is slightly different. Those who have the old textbook, it is page number 507. Page 523 in new textbook. So the first one is purine restricted diet. Purine restricted diet. So purine, it comes from uric acid. Okay, when your body produces uric acid, when it metabolizes a lot of chemical compounds called purines, that's when uric acid is made in your body. Okay, when there are too much of purines, uric acid will also increase, and somewhere the blood has to get rid of it. Okay, uric acid, your blood cannot carry high levels of uric acid because the pH will change. Okay, your blood will turn more acidic in nature. pH will change. So this extra uric acid has to be deposited away somewhere. Okay, either through kidneys and all, it can go away. Okay, or through depositing it in your joints and all. Okay, that only the excess amount of uric acid, those will get deposited in your joints. So hyperuricemia is seen in people who have high levels of uric acid in the blood and the kidneys are trying to balance it out. Okay, kidneys are trying to remove that uric acid out of the blood. So that's how you get hyperuricemia. Okay. Uricemia is too much of hyperuricemia, too much of uric acid in your blood. And kidneys are trying to get rid of the excess uric acid, and majority of it gets deposited in your body, especially your joints and bones. Okay, so these are the inflamed joints or bones where too much of uric acid gets deposited. Uric acid crystals form. Okay, that's how you get the gout. This disease condition is called gout. Okay, it's very painful. Movement also becomes quite restricted, and these inflamed areas where uric acid is deposited, it's very painful, tender, motility is affected, functionality of the joints are affected. Okay? And anatomically also, it changes a lot if you compare it to a normal feet. So when you go for a purine restricted diet, what are the things that you are allowed to avoid? Okay, what are the things that you are supposed to limit? You can have it, but in very controlled proportion. And what are the things that you can enjoy properly? Okay, so from the protein part of the food, anything that is organ meat, glandular meat. Okay, these have high levels of purines, such as liver, kidney, heart. Okay, all the other different types of glands. Okay, they are organs. Avoid organ meat. In beverages and drinks, anything that has too much of corn syrup, like fructose. Okay, that's a high corn syrup used in some sweetest of the beverages, not just alcoholic, like even the soda cans and all. Okay, those have high levels of fructose. And alcohols are also you have to avoid completely, because if a person has gout disease and they continuously drink alcohol, it will worsen the situation. Okay, smoking, excess body weight, crash diet, protein diet, these things you have to avoid. Limit not more than 4 to 6 ounces of or portions of red meat, beef, pork, lamb, that is red meats. Okay, fish that are high in purines are anchovies, that is very thin fish. Okay, anchovies, sardines, herring scallops, and shellfish. Okay, some poultries also, they are quite high in grain. They're quite high in protein type of food. Then coming to drinks, juice, alcohol, especially beer. Okay. As per doctor's advice, you are allowed to take, but without that, you are not supposed to. Then, other things that you can take care of. Okay, you have to limit, but you have to keep conscious. You have to keep a track of how much has been consumed. Okay, so table sugar, honey, any artificial sweeteners, sugary desserts. Okay, these things should be taught to these things should be taught to limit. And in enjoying part, all the types of plant proteins they can have, they can convert into vegetarianism as well, but with proper nutrition, legumes, nuts, butter, whole grain yogurt, low fat dairy products, eggs. It's usually only in Indian vegetarianism that eggs are considered to be non-vegetarian, but in other parts of the world, eggs are not considered non-vegetarian. Then low fat, non-fat milk. You can use milk if you are not sensitive to it. You can use milk at least 8 to 16 cups of water daily should be there. Unsweetened tea and coffee should be used. Okay, and it should be habitual. Okay, already if you're habitual, then okay. If you're not habitual, you don't have to push yourself to tea or coffee. Whole fruit you can enjoy, which is unsweetened with regular exercise. Next is ketogenic diet. So keto diet was not made for weight loss initially. It was made as a treatment modality to control epilepsy in some pediatric kids. Okay, and it worked. When the doctor had introduced ketotherapy, it worked. Why? Because you are kind of starving your brain. Okay, when too much of oxygen is available for the brain, it could be something quite difficult to process. Okay, so what happens is that carbohydrates is the one that gives a lot of energy to the brain. So here you are cutting down the carbs in your food. You are focusing more on fat. That's the first value factor to burn to give energy. Okay, carbohydrates will take a backseat. That's how it becomes easy to lose weight, because you are using a lot of fat oxidation. It will work wonders for women, but not that much in men. Okay. So ketogenic diet It was made for epilepsy, kids who have highly functional central nervous system that gets triggered very easily. Okay, that is epilepsy. So there are some signs and symptoms of epilepsy: staring at a space and not talking anything, convulsions, which is very common, stiff muscleness, being like the tongue is of different color than the community. Like they may have some white coat, okay, or based on the community like health, you can see people who have a lot of calcium deficiency, lower income community, okay, they suffer a lot from white coated tongues. Okay? And people who come from a nutritionally healthy community, they don't suffer from a lot of malnutrition. Okay, malnutrition can also lead to convulsions. It has been seen. Convulsions are pretty common in kids who had been impoverished by from severe acute malnutrition because their growth retardation had been stopped. Their central nervous system, once it gets a lot of food, it becomes highly active. Okay, so people who are from a certain community, from a certain class, okay, strata of the society, we see a lot of epilepsy happening in those kids. Those who have not received vitamin A prophylaxis on time, those who have not received universal immunization schedule on time, okay, malnourished kids. Okay? Epilepsies are very common in those children. Okay, so biting tongue, it doesn't happen purposefully. It just happens because when you go into a state of convulsions, your mind does not remember anything that had happened. Okay, before you faint, before the convulsions happen, what were the scenario a person can recall. But when they were undergoing convulsions, they will not have the alertness, they will not have the awareness of their surroundings. Okay, for them it is like they woke up from a sleep. Okay, so biting of a tongue, it is dangerous as well. There are many cases in which people have cut off their tongue because of epilepsy. Okay, with their own teeth, their tongues were chopped off because of epilepsy. Because the sudden reaction that happens, you can't control the kind of aggression or the power it gives into the bites. Okay, loss of bladder and bowel control because the central nervous system is acting up, which is supposed to involuntary move certain muscles. Okay, now that will not function properly because the movement is compromised. Even the involuntary movements are compromised. Falling, especially during convulsions, it's very common. So to treat to treat these convulsions and epilepsy, keto diet was recommended by pediatricians. Yeah, and that too, the kids who are put on ketogenic diet, they will not be receiving it for their lifetime. For a year or maximum till 2 years, the prognosis will be seen. If the kids are doing better, slowly they will be pushed into a regular diet. Okay, so ketogenic diet has never been like that there has never been enough studies to prove its claim of what it is supposed to do in a human body. Okay? Right now, the claims are very regulated. It's very narrow. Okay, under a proper guidelines, ketogenic diet can be followed. So fruits, potatoes, beer, rice, bread, and sugar, these things are avoided when you are on a ketogenic diet because these bring high carbohydrates. Okay, as compared to vegetables, they are low on carbohydrates, low on calories, but they are filling because of the fiber. Okay, so all the starches, all the cereals, carbohydrates, okay, that you have to take off the menu for making ketogenic diet. And then comes to fat. It's a fat-rich diet, okay, but healthy fats. Polyunsaturated fatty acids are uh, olive oil, avocado oil, avocados, peanut butter. Instead of olive oil, we will use coconut oil as well. Okay. different kind of seed oils. Coming to the protein part, 20 to 25% of energy should come from it. In protein, there is not much restriction. Okay, anything can be given to the child in terms of protein, whatever comes under the classification of veg and non-veg. And 50 to 10% comes from carbohydrates. Okay? So they have to eat a lot of carbohydrates as compared to protein and fat to reach their leader, because carbohydrates will cut down and give you glucose, but it is a very simple, easy procedure. But here the target is to lose weight. Okay, so if you want to rush and you want to lose weight, you can't lose weight rushing with fat. You have to be very slow with that. Okay, because slow oxidation is what burns fat. Okay, slow anaerobic exercises are what burns fat. Okay, but here you are rushing your body into using fat. You are not waiting for carbohydrates because the body somehow knows that carbohydrates will come, but it is not enough, okay, for the brain to function. So whatever carbohydrates will come, it will only be used up for the brain's health status, but the remaining fat that what you consume will be used up for the body's energy process. So body kinds of finds a way in which it does not have to depend on carbohydrates. It can be self-dependent on fat. Okay. So these are the advantages of ketogenic diet: diabetes, reduction in blood insulin level, increased mitochondriogenesis, that is formation of mitochondria at the cellular level. The more mitochondria you have, the more younger you will look, okay, based on the energy that has been put into from the glucose stores and from the fat stores. Then weight reduction. It has seen that people who follow a keto diet, they have reduced weight significantly. Okay, reduction of the risk of retraining your body into second round of uh, lipogenesis. For that, also you have to lose a little bit of weight, but that naturally takes place in ketogenic diets. Increased lilosis, it's a part of a hair growth. And cardiovascular parameters, your LDL particles will increase. There will be reduction in the coenzymes reductase activity in your blood. So those coenzymes will go down. It can reverse insulin resistance as well with ketogenic diet. Your body will be more appreciating towards insulin that has been secreted. It will not become insulin resistant. Epilepsy, it has been seen that ketogenic diets have helped in epilepsy. It works as a direct anticonvulsant that the keto bodies can be picked out of the body as it is. You don't have to wait for macrophages or any other foreign particles to come. Okay. These are the advantages of ketogenic diet. Then paleo diet, a very controversial kind of a diet. Okay, paleo, you are taking your digestive system and your diet plan to the age where your your ancestors who were hunter gatherers. Okay, you eat something very similar to them. It is the purest form of diet. Okay, that allows you to eat only the foods that humans ate in the first few million years that they roamed this planet by hunting, catching. Okay, they don't have some access to sweet on a daily basis. They have to wait till summers to come so that they can have some fruit and increase the fructose level. Okay, so yeah, these kind of a diet was what the hunter gatherers and all were eating. Okay, so this diet has shown in some cases that it can improve your health by eliminating high fat. Okay, the purpose here is how to take away that something that is bad, which you can consciously do. Okay, you don't have to follow paleo diet to eliminate high fat diet. You can consciously do that. Okay? And processed food, high fat food, processed food should be out of your diet. So that is a paleo diet. So these are the things that you're allowed to use in a paleo diet, which all vegetables, tart fruits that are seasonal, okay, nuts that you grow under the ground, the ground and over the trees, okay, the different types of nuts, wild meats like salmon, eggs, they all are good. Wild meats like the deer hunting, and also some people indulge in rabbit hunting. These are wild uh, meats. So, yeah, that is good for conditioning time. So that is good for paleo diet. And things that are not in a paleo diet, everything that is processed, refined, because those days we don't have the concept of refined flour, refined sugar, etc. So whatever your ancestors, your deciders they ate or they lived, that is exactly how more or less the person will eat and live in paleo diet. Then you have diet in cleft lip or cleft palate. Children who are born with detached cleft lip or cleft palate. There are two types, unilateral, only one side, the child's either lip or the palate is cleft. Okay, in the other case, you have the bilateral in both the sides under the nostril, cleft lip and cleft palate may be present. In some cases, it is just cleft lip. Nothing is wrong with the palate. Okay, but in some cases, both the cleft lip and the palate was not uh, develop properly. So when you look into the when you look into the into these facts, women who had deficiencies of folic acid and all, their children while developing by third month, okay, because that's when the neural tube develops properly, uh, and it will not develop properly, and that could lead to cleft lip, cleft palate, spina bifida, etc. Usually it is vitamin B complex deficiency, specifically folic acid deficiency. So you have a specific technique of feeding the baby. Since the baby may not have uh, the complete grasping of the mother's nipples, the latch score is low. Okay. In that case, you have to put the baby in a 45-degree angle, not hold it like a 80-degree angle child. Okay. While feeding the baby, keep the trip advisor open. Okay. So a little bit of height is required, a little bit of raise on the head end is required to feed the baby properly. And different types of bottle feeds are used. Okay, there the cover, the through which the milk comes out, that is significantly different as compared to a normal child's feeding equipments. So that's about special diets. If you have any queries, you can mention